Hello, this is Jingyan, and in this video we'll be looking at oral health and hygiene, including anatomy, diseases, and prevention, before investigating myths regarding oral health. All of us have been to the dentist before, some more often than others, but we are rarely taught the exact benefits of maintaining oral hygiene. As cliche as this is, it turns out that the mouth is indeed the window to your overall health, as studies have linked poor oral hygiene to heart disease, cancer, and diabetes. Taking care of our health is a lifelong commitment, so we will start by first understanding some basic anatomy. The maxillofacial region looks into the mouth and its associated areas, which include the maxilla and mandible, which are the upper and lower jaws, the tongue, the salivary glands, and the oral cavity. To be informed about the causes of oral diseases, we must first understand tooth morphology. Although there are different types of teeth, such as incisors, canines, molars, and premolars, they all have the same anatomy. Our teeth are supported by bone underneath the gums and have a network of nerves in the pulp that allow us to experience sensations when chewing. This is surrounded by dentin, and everything is protected by the enamel, which is mostly composed of calcium. The oral cavity is only one part of the maxillofacial region, so we can understand why there is potential for so many different types of oral diseases to occur in this complex structure. Perhaps the most infamous disease is the formation of caries, better known as tooth decay. When sugar stays in the crevices of the teeth, bacteria feed on this sugar anaerobically, producing acid as a product of this metabolic process. This demineralizes the tooth, and after a period of time, tooth sensitivity is caused since part of the enamel is corroded and pain is felt as the nerves in the dentin are exposed. Another common oral disease is gingivitis, also caused by bacteria in the form of plaque. If this plaque is not removed daily, the buildup hardens into calculus on the gum line, further collecting bacteria. This irritates the gums and causes inflammation, which may even lead to the loss of teeth. If you're not looking forward to having your teeth drilled, replaced, or extracted, all of these problems can be easily prevented with proper oral care. In terms of physical prevention, interdental cleaning aims to clean the spaces between the teeth, with flossing being the most common example. Regular visits should also be made to the dentist every 6 months to remove plaque and calculus so as to reduce the chances of gingivitis. Also, for those with many crevices in their teeth, pit and fissure sealants can be administered by the dentist to shield the grooves of teeth which may otherwise collect sugar and cause decay. Chemical measures can also be taken to prevent oral diseases. We should use toothpaste that contain at least 1,350 parts per million fluoride, so that enough fluoride can react with the minerals in saliva to form fluorapatite, a chemical defense system against caries. Another chemical with a similar effect is chlorhexidine, which is found in mouthwash. Of course, since the interaction between bacteria and sugar can cause many problems, it also makes sense to adjust our diet for prevention. This is why our dentists always advise us to cut down our sugary foods and drinks, as the reduction in sugar leads to the reduction in bacteria. With these common pieces of advice being explained, we should also bear in mind that there are several myths surrounding oral health that can also be explained scientifically. The first myth is that brushing harder cleans better. Contrary to popular belief, this leads to trauma of the enamel and gums and can directly lead to the recession of the gum line. The second myth is that bleeding gums are normal. If your gums bleed whenever you brush or floss, this may indicate a problem with your gums, such as the development of gingivitis. The last common belief is that chewing gum is cariogenic. This is only partially true. Sugar-free gums do not contribute towards tooth decay and may even help prevent it. This is because the action of chewing encourages the flow of saliva, which is alkaline and can in fact help prevent tooth decay. Of course, chewing gum cannot substitute oral care, and brushing and flossing should still be carried out regardless. So in this video, we have covered 3 points. First, we looked at the maxillofacial anatomy, in particular tooth morphology. Next, we looked at some common oral diseases. And lastly, we discussed the physical, chemical, and dietary preventions of oral diseases, as well as myths regarding oral health. Thank you for watching, and see you next week.